All right, the next cast is a PTB, and that stands for patella tendon bearing cast. This cast, there's a number of different ways you can do this, or at least position-wise. A lot of people think that you can get away with bending the knee at a 45-degree angle when you put this on, and I tend to disagree. I think that the knee should be at a 90-degree angle when you put this on. The whole point of this cast, a lot like a Munster, is it controls rotation of the tibia. Exactly, scoot towards me, perfect. Now, a lot of times on a short or a long leg cast or something, I would cut this. I'm not going to cut that on her. I will cut around the ankle though, because I'm going to fold all that back. The parameters for this cast are going to be the metatarsal heads. 90 degrees at the ankle, above the femoral condyle molds that you're going to put in, and your patella tendon mold that you're going to put in. This cast is going to go just above the knee until you put your molds in. And I'll throw a little extra pad here because this is where my molds will be, right above her femoral condyles. I'll actually try to contour the molds just like her condyles are. Throw a little extra pad down there by the heel. Capture that. You will treat any tibial diaphyseal fracture, mid-shaft, proximal third, distal third. A lot of times these are used for transitioning out of a long leg cast and into a short leg cast. This cast should be done pretty much only in fiberglass, although you can do any cast in plaster as well. There's a lot of molds to this cast. Again, because of it being a weight-bearing cast most of the time, I will wrap 4 or 5 times around the metatarsal heads, or at least the distal parameter of the cast, before I work my way up. Oh. I will try to throw a little extra around the proximal border as well, because I'm not going to be coming back here with a money roll. Some people will do this in 2 stages, this cast. I tend to think it should be all done in one. Any weight-bearing cast you want to try to do in one, other than a long leg. Plenty of time. Come back every time I come out to the distal border. I always make sure that I hit those toes quite a bit. Again, the weakest part of the cast is right here in the heel. Now, femoral condyle molds. Feel for the patella. Get her off the stand. Maintain your 90 degrees. For one time, I will put them on my foot or on my thigh. They also like to have a gastroc mold. So just a flattening of the gastroc. Femoral condyles and patella tendon mold I do all at the same time. Again, continue to go back, flatten out. I would like to spend some time around the foot, but because you got so much to do, you don't really get a chance. And once this cast is dry, I'll actually draw those molds in for you so you can see them. Again, flattening out the gastroc, flattening out the foot. Again, patella tendon bearing cast. And because you're trying to limit rotation, you always have to keep your eye on second toe mid patella ASIS again, because you are controlling rotation. I'm going to grab a pen and draw those molds for you. So again, the femoral condyle mold, come down, and you're on the top flare of the mold, therefore the cast doesn't dig into the patient. Patella tendon mold, that kind of limits the patient from getting full extension, because again, just like the Munster cast, if they get full extension, there's a good chance they're going to get rotation. Again, your patella femoral condyle. There's also a gastroc mold in there, and we're going to trim this out. You'd like to see. Take my padding. Don't peel it back. Don't get too aggressive. I split it. Let it lay over. I want all edges completely padded. I do the same thing in the back. Then I take and I fold back. Again, no different than a short leg cast. Supporting the metatarsal heads. You can see you cannot see your heads or toes overhang. The heads are supported. It should limit her from a little bit of extension, maybe 5 degrees. She will not be able to rotate. She should be able to get full flexion. And some obese patients, sometimes you have to settle for 90 degrees. And then a money roll. And again, I'll leave my, so that you can see all that stockinette. PTB.